computer. All right. Hey guys, this is Dr. Sydne Pomin. I am a chiropractor and owner of TAM Chiropractic, and I'm here today with Dr. Amy. You want to introduce yourself, Dr. Amy?
Sure. Well, my name is Dr. Amy Shouse, and I am the clinic founder and director of the Northern California Center for Integrative Medicine.
And we are here today. Dr. Amy and I have been in communication pretty much daily since all of this started. We both are a bit of research geeks and trying to assist and help our patients as much as possible. And we realize a lot of the things that we are organically coming up with right now and the conversations that we're having are actually have some beneficial information in them. So we wanted to share them with our people.
Perfect.
So I think the first thing that I'm getting asked about all day long is immune system. Like, what do I do with my immune system? How do I support my immune system? How do I figure out, there's so much information and dense information out there right now. Dr. Amy, how are you navigating that with your patients? Like, what is the top thing you're telling them to do right now?
Well, the first thing I want to emphasize is the importance of simple things. And we all know right now that social distancing is the thing to do. We all know we need to wash our hands. I don't want to beat that dead horse. That's pretty much known. But I think what I think is really important is getting enough sleep, and getting at least 8 hours, and probably trying to stay on a regular schedule, and getting a little exercise every day and building that in. A lot of people are taking walks and doing home exercises. But just kind of re-emphasizing that those are actually very important things, those simple things that we typically try to get done every day. But as we all kind of sit at home, or if we're working from home, we can kind of let it go to the wayside. So I just wanted to kind of emphasize that, and that actually keeping a schedule is really good. Like when you get up, to not just stay in your PJs all day, to take a shower.
I think we've all been guilty of that.
Yeah, I've definitely been guilty of that for sure. And it just, when I do it, by 2 or 3 o'clock, I just feel kind of gross.
Yeah.
So It's at this point, I'm just I get up and I'm okay, I'm going to take a shower. I have my Zoom appointments with patients or whoever I'm meeting with. And so just kind of emphasizing those simple things.
Yeah, absolutely. I think that with my patients, I'm getting that too. And I think the other thing that we're really focused on in our office explaining to our patients is also the idea of the difference between exercise and movement. It's okay if you don't get a full-blown exercise in, right? We're feeling a lot of pressure and cultural stress to, I have to have my best summer body after quarantine. But really trying to get that idea of just move. Do not stay in the same position for too long. Do not Netflix and chill for 6 hours and not move your body. Literally the power of 3 to 5 minutes of just focused movement and breathing built into our day it's not only important just for our mental health, but from an immune system standpoint, like we were talking about, is that movement is which pumps the lymph. Lymph is what detoxifies our body, and the importance of that. And you combine that with hydration, and that's one of the best ways to keep your defense mechanisms up as strong as possible.
Absolutely. I totally agree with that. Yesterday, it was yesterday, the day before. See, all the days are bleeding in, right?
Right.
I just got up and went out and sat in the sun and kind of jogged the parking area where I live.
Yeah.
I live in a big apartment complex, so I just jogged the area and got my blood moving, and that felt really good, even just for a couple minutes.
And that exposure to sunlight right now, I think, is so important.
Yeah.
We're so lucky in Marin County I know we've had a couple rainy days, but I know that there's a lot of information going around about vitamin D, and you were sharing a lot of it. And we don't have access to go test our levels right now, really, to see where we are. But that importance of that access to I always tell my patients, get direct sunlight on your skin. And in places that don't always get direct sunlight, like the underarm here, just sitting out just 10, 15 minutes. Because that's, again, I think you and I both share that same value of where can we get these tools as naturally as possible without going crazy and going down, the rabbit's hole of, well, I need 47 supplements, or I need to go buy the latest and greatest Amazon detoxifier right now. It's there is a lot available to us just in our homes and in our daily activity that can help support our bodies.
Exactly. I completely agree. And on the vitamin D trip, I know a lot of people are asking about how much should I take, and should I take these huge amounts? And what I have kind of found in my research, and Dr. Chris Masterjohn, who's a nutritionist, I follow his work, is that the vitamin D, taking high doses might not be the best idea. Maybe to take like low doses and try to get into the sun a little bit, because it can potentially upregulate that receptor in the cell that the coronavirus attaches to. So we just don't want to be taking like 20,000 international units a day or 10,000 international units a day. I know, like I was, saying on a blog post recently that, if you run low in the wintertime, or run low in general, to take like 400 to 1,000 or 2,000 IUs, but don't 5, 10, 15, 20,000 IUs, international units a day. That would be kind of like one of my recommendations about that. And in just getting the sunshine, getting in the sunlight, 20 minutes.
Yep. And that's probably more powerful than any supplementation you can do, really, because the sun brings a lot more things than just stimulating vitamin D. So I appreciate that.
Mm-hmm.
And I think that's the thing that you and I are trying to stay on the pulse of right now, right? Is like the recommendations that may have stood before don't necessarily stand right now. So I appreciate that information, and just kind of, I think you and I are constantly trying to just stay on top of what's coming out. And I feel that really is our responsibility right now, because I know another value you and I share is the idea that doctor means teacher. And so we're just trying to stay on top of this information as much as possible and adjust things as we can when we get the information.
Exactly. Because we know that this is a new virus. We know we're not sure how exactly it works, but we do have information on the first coronavirus, the first SARS virus from 2003. And this virus is 87% identical to that one. It is a little bit different in terms of severity of disease, but the other one had more of a higher mortality rate and more severe disease for most people. But the evidence and the information coming out is changing a lot daily.
Yep.
Yeah.
And I feel that a lot of my patient interactions right now have really changed to these Zoom conversations or phone conversations, right? Which is interesting for my line of work as a chiropractor, which is a very physical medicine, but giving people a lot of tools of the things that they can use at home. I imagine you're getting that as well. So I wanted to just talk about the top 3 frequently asked questions I'm getting from my patients, and I'm curious what yours are as well.
Yeah.
Okay, I'm going to hop right in. A lot of people are working from home, and so I'm getting a lot of emails and questions. Dr. Sydne, how should I set my home desk up? What should I do? What should it look like? And my top recommendation for that is, it's not necessarily about how well the actual setup is. It's about how well you can have diversity of movement in that setting. What do I mean is, can you sit for 30 minutes and easily transition to standing for 30 minutes? So I'm not necessarily too fixated on what the details of the actual setup are. I'll be putting out information to help with that shortly. But really, my key takeaway for my patients is telling them, make sure that it is a diversified setup, that you can go from sitting to standing to sitting on the floor to being in different positions, because again, it's that movement piece, right? Really parsing out the difference between exercise, which is important, but movement, which I look at, it's almost something we have to do consistently throughout the day to really keep our tissues as healthy as possible. So that's the first one I'm getting. The second one I'm getting is, why am I so tired? Right? And I could totally relate to this, because it feels like we're doing less. It feels like we have more time on our hands. So how could we possibly be more tired? And the information I'm giving to my patients is the idea of, we are really all in a bit of a trauma response right now, right? Like, I'm sure you're seeing it with your patients too, and our bodies, we can't really go into fight or flight now. We can't go run away from this corona tiger that it feels like it is. So our body's next best mechanism is to slow things down and start to preserve energy. So really just encouraging my patients to lean into the tired, like lean into the resting that you need to do. Like, if you need to Netflix and chill, take your breaks, stretch your body, but Netflix and chill, because we are not on a normal crisis curve or trauma curve where we, like, say somebody dies and we get a burst of adrenaline to deal with the emotions of that, to organize a funeral, to have everything, and then we get a moment where it's all done and we get to kind of start coming back to whatever our new normal is. And I don't think this has allowed us to have any sort of new normal yet. Every day is producing adrenaline. Every day is making us, I mean, it's scary. It's scary right now with the statistics and the unknowns. So leaning into the tired, being okay, this is not the time where you need to like worry about getting like your coronavirus summer body, or you have to write, you know, the next best-selling novel. There's a lot of like productivity crap out there right now. And I think that
really,
if it doesn't resonate with you, don't do it.
Can I just say that
Please.
I've definitely felt like the first few days of the lockdown, I was sort of in shock, but there were a number of days after where I was like exhausted.
Totally.
So
like,
I totally
why
know
can't
what
I
you're
move?
saying.
Yeah.
And there are some days where I still feel that because I'm probably not moving enough, you know, but also just feeling like in it, that just fatigue, like where's this fatigue coming from, you know?
Exactly. It doesn't logically make sense. It doesn't logically make sense, but it totally, if you step back and you look at it from the standpoint of what our nervous systems are being inundated with, once I put those pieces together, I was like, okay. And you can forgive yourself a little bit, right? Because sometimes, I mean, I think you and I both identify as little type A, like little doers, right? So when I'm not doing, I can get into a pretty big funk.
Absolutely. So that's really good feedback to lean into it. I love that.
The third question that I was getting is, and you and I both deal with pain all the time, so you can hop into this as well, but people are in more pain. Like we are sitting, we're not moving around a lot, and we don't have access to, like, I'm only seeing emergency patients right now. So I have to give my patients different tools of how to navigate these pain patterns that we used to be able to nip in the bud, having them come in the office. But again, I'm going to sound like a broken record here. Movement over exercise, consistent, daily, multiple times a day movement. Never underestimate the power of being hydrated, because when we're not hydrated, everything else is off course. And then just the reminder that we can do these, and you're doing it too with your patients. Call us. You know what I mean? If you're having a pain flare, call us. Like I might not be able to adjust you, but I can talk you through a lot of things over the phone. And I know that's a service that we're offering complimentary to our patients and non-patients. And I'm sure you're seeing it as well. But I think also just don't ignore the pain. Don't pop 4 Advil and just ignore it. It's like, hey, let's have a conversation about it right now, because the crazy thing about the psychology of pain is when we acknowledge it and label it, our nervous system can process it better.
Yeah, that makes sense. That makes a lot of sense.
So how about you? What questions are you getting right now?
So I'm getting, people are basically asking like, what can I do to support my immune system right now? And like, it kind of goes back, and I'm going to sound like a bit of a broken record also. It goes back.
We got this.
Yeah. You know, it goes to getting enough sleep a lot, get 8 hours, you know, do your exercise and get yourself on a schedule, get up. And I've kind of seen two types of people right now: the people who don't have a lot to do and they're stuck at home, and we're all stuck at home, but and they're watching a lot of Netflix or whatever. And then I have people who are actually working.
Yeah, absolutely.
And they're working their asses off from home, and they've got 2 kids at home, and they're just like frazzled. But I still think it's important to try to keep up that schedule. And so all of that will address like better well-being and immune support. But and then people ask me what foods or what supplements can I take right now? And that's a big one. So everybody knows about zinc and taking zinc. And so I would just like to emphasize like the nuances of how to take it and what to take. So the top 3 are probably, you know, right now, or a lot of people are taking elderberry. So people are taking that around 700 milligrams a day. But like the zinc is important for people to know that your body can only really absorb about 7 to 10 milligrams at a time. So you want to take about 10 milligrams of zinc a few times a day, and you want to try to take it away from food, because we know that zinc does help the immune system. It helps your cells fight the virus, and prevents the viral particles from duplicating. So you want to take it properly.
When
And
you
not
say
waste.
take it away from food, does that look like 30 minutes, a couple hours?
It could be about 30 minutes, and it's really specific foods too. It's grains and beans, whole grains, because some of these, and some vegetables too, that inhibit zinc's absorption. So you really want to make sure you're like taking it away from grains and beans,
Okay.
essentially, like, and those types of things. So, but if sometimes zinc can make people feel a little nauseous, so you can take it with food, but just take it away from those items, and you always want to balance your zinc with a little bit of copper. So you want to take a zinc that has a little bit of copper with it, or you want to take food sources of zinc like oysters. Some people are doing dried oyster powder if they can't find actual zinc supplements. And that also has a little bit of copper in it, because those two things really balance each other out.
Nice.
So I'm just kind of blending like the supplement and food stuff together with the questions, because the next question was, what food should I eat to feel better? And you want to make sure you're getting enough vitamin A. Eat your pasture raised eggs, that has enough vitamin A. And potassium is also one where we know this virus depletes the potassium. We're pretty sure it does, because of the way it works in the body and the lungs, and how your lungs help regulate electrolytes in a sense. And so you just want to make sure you're getting enough potassium. And in my patients who know me, they know that I'm always telling them to stop eating bananas, eat avocados instead, because they're higher in potassium and they don't have as much sugar.
Exactly.
So
and
I
you
could
did
go.
Actually, yesterday you did a post about the potassium, right?
I did.
Yeah, I
I
sent that
did.
to a couple of my patients. It was really helpful.
Oh, great. Yeah.
Yeah.
So, and just getting some broth, bone broth, if you're
Love bone broth.
yeah, bone broth with a little, bone broth is like liquid collagen. It has all these minerals in it. You add a little grass-fed butter, there's your vitamin A. It's like a little immune elixir. So,
And I always, when I'm telling people about bone broth, I always remind them, it's like 100 years ago, we used to eat all parts of the animal, right? Like we used to utilize organ meat and bones. And now if you're just going to the store with the standard American diet, you're eating the muscle of the meat most of the time.
muscle meat. Yeah.
And that doesn't have all of those amazing building blocks. And for me, like I'm not a big cooker, and I found some awesome, like pre-made bone broths that I've been great.
Right. You can totally get pre-made bone broths. I'm lucky because my husband's a chef, and
You are very lucky.
I know. So he makes it, but yeah, pre-made bone broths are fine. And you can add a little sea salt, add a little, you could even add a little, what I do sometimes, maybe add a little, what's that stuff called? Sorry, I'm blanking. Molasses, blackstrap molasses too is one. Has it has potassium and tons of minerals. So really, like from the food level, there's a lot you can do.
Yeah, I love it. I think that's pretty good for today, but I think that you and I will be doing more of these. Just as I said, Dr. Amy and I are just actively learning and trying to stay on top of this and provide resources for our patients in this very crazy time. I know that myself and Dr. Amy are always available via email, Zoom, FaceTime. Just, now's the time to just ask for help. Like we're all in this together. We're all processing this together. We're all going to get through it together. And we just wanted to come to you guys today and give you just some of the information we were talking about.
Exactly.
Thanks for your time, Amy.
Thanks.
Talk to you soon.
All right. Take care.